Hello, everybody. Welcome to What Comes Up Comes Out. This is your host, Precious Ava Aquinas. I'm back and still trying to figure out what I like to say. This is my first guest, Stacey Hudson.
Hello.
And today we're going to be talking about some of the things that I've been doing since I've been away. So before we get started with Stacey, let me just make sure everybody knows that I'm well. I'm doing great, as you can see by these beautiful earrings and its red hue. Part of why I'm doing a whole lot better is because in my time away, I did learn a different aspect about self-care. And so Stacey played a vital role in it. So I want to talk to her about some of the things that she does and also some of the things that I've taken away from her. So if you're ready, sit back, pull up a seat, get you a beer, a glass of wine or some water, and get ready to listen to some life-changing information. All right, Stacey, you ready?
I'm ready.
Okay, great. So again, welcome Stacey to What Comes Up Comes Out. And I hope that my community makes you feel welcome. Before we get started, can you tell us a little bit about what it is that you do? Before we get started, Stacey happens to be a massage therapist, and she's also a nurse. So I'm going to let her tell you all a little bit more about what it is that you actually do for your patients or clients.
Okay, well, how we met as your massage therapist.
Correct.
And I happen to also be a nurse.
Mm-hmm.
But what I love more so than anything is wellness. And I find that utilizing both my backgrounds as a nurse and a massage therapist, I'm better equipped to give people a more well-rounded plan, resource, and more than anything, just something that's out of the ordinary. I am not too medically, I'm not too alternative medicine. I am in the middle of both, so
Okay.
I support both ends because I am here for the client,
Mm-hmm.
and however they perceive their wellness,
Mm-hmm.
I'm here to help them navigate that.
Right. Yeah, one of the things I love most about Stacey is she was able to take some cues from me, and it was difficult for me because, Eric passed and we divorced before he passed, and so Stacey kind of met me. Prior to that, I had 2 regular massages prior to what I like to do now, which are lymphatic massages. She's going to talk a little bit more about what those are, but Stacey never forced me or made it seem as if you need to do this. If you don't do this, this is going to happen. It was very much, I asked a question and she responded, which I appreciated. And if I had follow-up questions, that's one of the things that I appreciate the most about Stacey's service is it's not just when she's with me for that hour, helping me with my body. If I have some follow-up questions about the things that we discussed, then she definitely responds. So we'll make sure you all have her handle and or contact information at the end. So I want to start with asking a couple questions. And you all will see me look down. Maybe in the future, once I get my whole team, I'll have some cue cards in the back or teleprompter monitor, whatever the proper name is, and I won't have to look down. So I'm just going to try and read from some of these questions that I actually did right now. So since it has been a while, I'll just start with the first one. What is the most unexpected benefit of getting a massage?
The most unexpected benefit is self-awareness, and an example of that would be someone will come in and say, okay, well, I've come here to get my sinuses drained. So in the process of doing a sinus drainage massage or a lymphatic drainage massage that aids in sinus drainage, I might touch the shoulders or touch a certain area of the body, and that client would say, oh, I didn't know that hurt. I didn't know I was tender, or I didn't know I had pain in that area. And I find when you incorporate therapeutic touch, people realize that there are other areas of concern or body areas that they were unaware of, that may need more attention than what they thought.
Yeah.
If anything at all. So.
Yeah, that's true. A lot of what I experienced while under Stacey's care or being one of her clients, I know that my job can be high in stress But I want to talk about the next topic, which is going to go into a little bit more about what I've actually been doing with Stacey. So we hear a lot about different types of massages, and lymphatic massage, which is what I've been getting primarily for the last year. It just kind of seems to be on the trend lately. In fact, celebrities live by these types of massages when they get detoxes. So can you tell us what a lymphatic massage is and why people are really interested in it right now?
A lymphatic massage is considered a medical massage, and in our bodies we have the lymphatic system that have lymph nodes all throughout the body from head to toe, and they're finding in medicine that when you activate the lymphatic system, because it's a lymph system that requires movement, it does not have a pump, so the movement of our body is the pumping of the lymph fluid from one area to the next. So we learn the lymphatic flow for every area of the body. And when you are educated in knowing which direction to massage the body to aid in the lymphatic elimination, we find that less swelling, overall increased immune system, and more than anything, overall wellness. And they find when you massage the body in the lymphatic flow, you gain the most benefits from a massage. And this have taken celebrities, common blue collar workers it's taken it to the next level. And when you learn that there's more than just a touch to massage, there is a medical touch to massage, and lymphatic is that for everyone.
Yeah, Stacey, I learned later, helped me because I suffer with sinus year round, but she helped me understand holistically because I had some health issues going on with my stomach, and she just helped me understand you got to move the system, and there are certain ways that you have to move it. It's clockwise, right?
Yes,
it's clockwise.
When you're dealing with the digestive tract, but if you're dealing with a lymphatic flow, the abdominal area, you're going to be massaging from top to bottom, so it's going to be a more inferior glide down.
Listen to that, inferior, used in the right way. Okay, so just to give my people who are visuals, what that looks like. I'm a short person, so I'm gonna step back. So when you say inferior, can you kind of demonstrate when you say move down when we're talking about the abdominal?
So earlier she was talking about for digestion. So digestion, you have a ascending colon, transverse colon, and a descending colon. So specifically for digestion, you're just going to go up, across, and down with adequate pressure. Now with lymphatic, we know that you want to drain the lymph fluid in the abdominal area to the lymph nodes in the growing area. So you're going to push that fluid towards the lymph node here. So you notice it's going to be going inferior, downward, as opposed to in a digestive massage, you're going up, across, and then down. So it's important to know the needs of your client so you can properly massage them for the purpose that they're coming for.
Yeah. The other thing that I want to share with you all is I talked about how I have sinus issues year round, and I didn't realize that massage was something that could help. And Stacey taught me, and I've been seeing a lot of these, and I'm going to say it wrong, I know. But basically, I just kind of touch my face and drag it. So I won't have her do it too heavy because I do have on makeup, which you all can see. But when I do use the pressure of my fingertips and start here and move it down, I can tell a difference. The pressure is not that bad for me. Right. But you call it, I have to move it hit to my ear, my jaw. Which one is it?
So we have lymph that is here, here, and we have pockets where fluid can accumulate. So when we're doing a basic lymphatic massage for the face or a sinus drainage lymphatic massage, we tend to press the nose away, and we're going to press, come down, and drain, and pump. So you're just going to press, come down, and drain and pump. And you're going to complete that process over. And for some people, it can be painful. But as you continue to do it, you will feel the relief of that congestion.
Now, I don't do it as well as Stacey does when I'm doing it on my own. I typically do what I demonstrated to you all, but I can tell you just when she does it, I feel 100% better instantly, and I can sleep better because my sinus pressure is really bad, and it's year round. And in fact, there are different tools or apparatuses that we've used. And one of the guns, it was, oh my gosh, was it a vibroscope?
Yes, we've used the vibroscope on the lower setting. We've also used the TheraFly on the lower setting. So we find that different tools that have a vibration to them can be utilized. And in doing so, it actually magnifies what a human hand can do.
Yeah, and it felt weird. Thank you so much, Stacey. It felt weird in the beginning, but just like she said, as you continue to get the massages, you can build up a tolerance. And when she was showing you all the lymphatic drain, it used to be very uncomfortable for me because Stacey has strong hands. And so I would often say, Stacey, the pressure. But I can tell you, I have built up a tolerance for it. And if she's not putting that pressure, it's not the same for me. Or I can actually kind of sleep through it. We can have conversations now because I have built up such a tolerance for it. So thank you so much for telling us about what a lymphatic massage is and why it's so important, or why people seem to kind of be excited, or this is a new trend. Can you tell us a little bit about what inspired you to pursue both nursing and becoming a massage therapist?
Well, my mother's a nurse. And
shout out to Miss Cynthia.
And because that's what she does, she really was influential in pushing nursing in the home. So I loved massage in the very beginning. But because my mother wasn't familiar with the field of massage beyond range of motion, restorative care that a nurse learned in fundamentals of nursing in nursing school, she wasn't quite sure, and she wanted to make sure that I was going to go into a field that was going to be supportive. And because of that, she really didn't support me as a massage therapist initially. And so I started massaging in 2001 and started humble beginnings as a mobile massage therapist. And
but you were doing this also with small kids too, right?
I was. However, still my mom, she was like, nursing, get you a nursing job.
Right.
Nursing is everywhere. But massage has always been a part of nursing.
Right.
But she didn't view it like that.
Right.
And so when I went after doing my first client in 2001, and then of course my mother didn't support that, I went on to nursing school, passed my nursing boards in 2004, and 3 months later I went on to massage school and acquired my massage license in 2007. And that's only because the Georgia board was established in 2007.
Oh wow! So you were kind of part of that beginning stages,
Yes.
or you were like the forefathers, if you will,
Yes.
of that. That's pretty interesting.
Yeah.
I don't think I knew that part. Isn't it amazing how our parents, whether they approve or disapprove, have so much influence in what we
Yes.
do or don't do, even as adults,
Yes.
when we can vote, have babies, smoke or drink alcohol, or leave their house. No, I'm just saying, like legally you have to be 18
Right.
before you consider an adult, 21 to drink, but it's just interesting how, even though that was your passion, okay, because your mom's like, okay, Stacey, you need to be doing nursing.
And I did it.
Yeah.
And I'm glad, looking back, that I did obtain my nursing. However, I'm so glad that I did pursue my passion, because when you do what you totally love, it never feels like work.
Yeah.
Never.
Yeah. How many of y'all can say that? What you do every single day you actually love? Or does it feel like work? Leave your comments in the below so that we can kind of talk through it. I can tell you, for me, I genuinely enjoy helping people. Stacey has observed some things, and if she talks about it, great. If not, that's fine. But I do enjoy helping people. However, I know that everybody's not always fortunate like Stacey to pursue their passion, and have someone like your mom in the background saying, you should do this because of the stability, or I'm just not really sure, what's going on. My mom preached, you all are gonna, I'm the oldest of 5 girls, you're gonna go to college, you're gonna go to work. One of her phrases was, you're not gonna lay around and have babies. She always wanted us to do better than her, or to learn from the people around us. And I think part of, for me in my journey, because you could ask my sisters, it would be different for them. For me, that's how or why I ended up in the business world. But I did actually get a offer from Barbizon when I was 18 to actually be a model, and I actually wish that I had an opportunity. I was heavier then, I was obviously younger, but my mama told me years later, she said, Precious, it was 5 of y'all, and I just could not go up and down the country, the world, or roads with you and your sister. She was like, you had to go to school. So I just give that story to let you all know that parents definitely play a huge role, whether they are for it or against it, or if we're thinking about it. But the other thing too is, my mom didn't just say, no, you can't do it. She said, you got to go to school, just like your mom did. But it's never too late for you to do whatever it is that you want to do. Hence the reason I'm doing this podcast vlog. I'll be 40 this year, and I still don't think I know what I'm doing. Right. Thank you, as far as like the technical aspects of it, but I am working diligently to try and be better, because I'm not an Apple person. I bought a MacBook Pro, Mac Pro Book, whatever the pro name is, in conjunction with my iPad. So I'm gonna get there, people. Just stay with me, okay? Sorry, sometimes I deviate, but thank you. So you've given us a lot of massage therapy aspects of how it complements traditional medical treatments. Can you tell me what you would like to see as far as nursing and massage therapy evolving together in the future? We're in 2024, and you said you started in 2020. I'm sorry, in 2001. That's a long time ago.
Yes, it was.
That was a long time ago. So tell us a little bit about evolving together.
Well, as a nurse, I did have an opportunity to teach fundamentals of nursing, and people who take that course and they become certified, they then are called certified nurse assistants, CNA.
Right.
So while teaching that course, in the book that I was utilizing, Pearson View book, it had a area talking about range of motion and massage therapy. So I was like, okay, so in fundamentals of nursing, which is the first class you would take if you were to become an LPN or RN, everyone have to take that course.
Right.
But nobody put emphasis on
the massage
aspect, because there are many professions that can utilize massage, but they just don't call themselves massage therapists, because as of Georgia, the massage therapy title did not come into play until 2007. So all these other professions that had it a part of their curriculum, that's your CNA, that's your medical assistants, that's your kinesiologist, that's your exercise therapist, they all are perfectly capable of performing massages, but they perform it under the guise of their professional title. So when I learned it, I'm like, okay, this is a part of nursing. Fundamentals of nursing, nursing fundamentals. So I saw that it really isn't separate from nursing. It just has not been expanded. So give you an example, cosmetologists, they are taught in hair, skin, and nails.
Right.
Whereas an esthetician focused specifically on the skin, and a nail technician focused specifically on the nail health. But a cosmetologist has the engulfing of all of it. So nursing engulfs massage, whereas a massage therapist, instead of giving medication and documenting concerning that, they just focus specifically on that area, but nursing engulfs it all.
Oh, wow.
So.
And there you have it. So you can continue to do nursing, but also include the massage, which obviously or apparently is a part of the fundamentals. Okay,
That's
cool.
right.
Thank you so much for telling us about this. So can you describe the role of stress in physical health and how massage therapy can actually help alleviate it? And you can use me if you want to.
Oh, okay.
Or not. Whatever makes you comfortable.
Well,
Stacey.
it's been proven that usually within the first 5 to 10 minutes of a massage, it takes you from a sympathetic nervous system to a parasympathetic nervous system within the first 5 to 10 minutes.
Wow.
And so if you're unfamiliar with what I'm talking about concerning sympathetic and parasympathetic, sympathetic nervous system is dealing with the fight or flight, and so you're ready to run and get out of
Harm's
danger.
way. Right.
And so your circulation, your heart is pumping. You're in a high stress situation because you are getting out of danger. But parasympathetic is where you're able to relax, rest, digestion is better in that area. Your breathing is slowed down, your heart rate has dropped, and massage is able to establish that within just the first 5 to 10 minutes. And that in itself has reduced so many people's anxieties, so many people's pain tolerance has been affected by that. And that is important because everything starts with this nervous system. Yes.
You know what I find interesting as the lymphatic massages have become as far as a trend, or that celebrities live by them. You know, they're getting detoxes. Why don't we hear more about massages being offered in the medical, not just as adults, like babies when they have what's in their tummies about colic? Is that the one I'm thinking about? Or like if someone has, you know, our GI tract when the digestion. I don't recall hearing about this as a child. Massages. I mean, when you were talking about the digestion, I remember my mom telling us when we had a hard time going to the bathroom, she would say, get up and walk, and she'd make us drink water, and she would tell us to rub our stomach. Nothing as detailed as what you told us, but that's probably the extent. When her back was bothering her, I mean, she would have us, you know, press our hands. In fact, my sisters were small enough and they would walk on her back, and I'm sure people still do that, right?
Yes.
But I don't recall ever hearing a doctor or someone with an MD or medical field saying you should get a massage. I just don't recall ever hearing that.
In more recent years, especially concerning Georgia, massage was not viewed as a professional practice.
So what?
And that's why it was important for us to establish a professional board.
Okay.
And before that, people had a very negative taste about massage.
Okay.
Some of your shady places,
There you go.
They may have the term massage in there, but they were doing everything but massage therapy. So because of that bad taste of massage therapy having a bad name, it was important to have a professional board for us to be taken seriously. So that is why you really don't hear the term masseuse anymore. It's massage therapy to show that there's training, there's science and schooling behind that title. And we pride ourselves for having a strong board here in Georgia.
Y'all did not hear about her. Y'all saw her check me. Hold on, wait, because I was gonna say if that's the case, and you just answered it clearly, it's because when I think about it, I remember hearing or seeing those signs, you know, happy endings or
neon signs.
Yes, flashing kind of like the convenience stores.
Yes.
And you know, listen, it's the oldest job in the world. You know, my daddy used to say, "Ain't nothing new under the sun." But to your point, I guess that is the consensus in any civilization or organization. There has to be some type of recognition professionally,
right,
nationally or locally at least, before you can start saying, okay, yes, I understand why you want to do this, or I support you wanting to go, and or you can make a great livelihood out of it. Because at the end of the day, that's what parents want for their kids, to be sustainable or stable, whatever they decide. Okay, cool. And you again were a part of that in 2007 when that board was set up. Okay, cool. So you've shared several different examples already, and what I want you to do now is share a massage therapy story where it made a significant difference in a patient's recovery. And again, I'm sure you have a ton. You've been doing this since 2001.
Yes. What I find common is when people are suffering from sciatica. I've seen where sciatica has been so debilitating where an individual could not walk. And she had been struggling with walking for 2 weeks. And a best friend of hers called me, and it was about 10:30. 11 o'clock at night.
Wow.
And he said, my friend, she's in agony. She's been like this for 2 weeks. I know it's last minute, but I need for you to go and see her immediately. And so he told me where she was. I traveled to her, and of course, when I got there, pain will make you be in a dark place.
Oh yes.
And so
You've seen that with me.
I never take people how they respond to me personally, because pain will make you say some things that you think you would never say.
Right, that's true.
And because she was in this position for 2 weeks, she was like, okay, so prove to me what you what you can do for me. I can't walk. I was walking 2 weeks ago. This sciatica has gotten me down. And so my best friend said you the one who's going to help me walk. So I want to see what you're talking about.
Right.
So I first then calmed her down and I said, okay, everything starts in the mind. Do you want to walk? And she was, yes, I could walk. I want to walk. If I could walk, I would be walking. Okay. I did not take it personal. I said, okay, so do you believe you can walk if I help you? I believe it when I said, okay. So you're going to allow me to help you. So you want to always get consent.
Mm-hmm.
All right, you can help me. I don't believe you. I don't know. So I was, okay, we're going to start little bit by little bit. So the lady was laying in the bed. I met her where she was. And as I massaged her and did the various stretches, she screamed, she yelled, but it was okay. And I assured her. And so little bit by little bit, I asked her to stand. I can't stand. And I said, okay, let's try. And so every time I would work with her and work on the glutes, work on the hips, work on the range of motion, then I was telling her, try to stand up. And every step, she became more confident.
Mm-hmm.
And she saw that the pain her anxiety was decreasing,
mm-hmm.
the pain was decreasing,
mm-hmm.
and she started gaining more confidence in me.
Mm-hmm.
And you have to gain the confidence of your client. And when she was able to stand and take a few steps, she was sold on massage.
Was she? How long did that take, if you can recall?
I got there.
I'm sorry. How long did it take for her to be able to walk? Did she walk that first visit?
She walked that
this
first
was
visit.
Not one or two visits. This
No,
was the
ma'am.
first one. Oh, wow. How long were you there with her, if you can recall?
I was there for about 2.5 hours.
Wow. Now you've already gotten a call. Now this is what you call VIP. Curbside. I'm giving everybody diamond top tier service. So you got this call at 10:30. I'm assuming you probably got to this person's place about 11:30, 11:15 or whatever, right?
Okay.
And you just told us that you were there for about 2.5
Yes,
hours.
yes.
Now obviously the kids have gotten a little older, and so they're independent, they don't necessarily need you, but you need rest too. This is the commitment that she is capable and does consistently. I'm not as unhealthy as I was before. Mostly what we do for me now is maintenance, but you were able to help this woman, and I know that she definitely believed, and not only that, she was very grateful that you were able to help her, because I'm sure she probably had gone to other people or tried whatever the doctors made. While you were telling that story, I promise you, what I kept thinking about was a woman in the Bible with the issue of blood. And Jesus said, because of your faith, because there are various versions, and she just touched the hem of his garment. And that's, I'm not glorifying Stacy, or saying she's a God. Don't misunderstand, but you were able to do servant work, and you asked the questions that nobody else probably was asking her, and you helped her understand, I'm still going to be here to help you. Anytime Stacy does something significant for me or gives me new perspective, I always tell her it's because of that medical background that you have, that you're able to help. And it's not just because, she's been helping me for a year. I didn't know Stacy prior to her starting to help me. And again, I had gotten to, regular massages, deep tissue prior to her starting, specifically with the lymphatic massages. But again, it's the caring concern that keeps me coming back. You're welcome. And I'm trying this new holistic type of thing, to detox and not take a whole bunch of pills. And, she's like, you can do this. And she just rattles it off, rather quickly. One of the biggest things that I've learned, though, while speaking with Stacy and trying to self-discover, if you will, is I can do a lot of things the natural way, but it's about discipline.
Yes.
That's really what it's about. So thank you. That was a very inspirational story. I imagined, again, that you had seen this woman over several days or weeks, but this was one night, one day, or 2 days, if you will, because it started out one day and then you meshed into the other. So that's cool. And this person, to your knowledge, because everybody has their own story or path, they're still doing well. Yeah.
Yes.
Okay, that's good to hear. And so if someone is, because I experienced sciatica issues, it's very painful, it's uncomfortable.
Oh, yes.
What's something that you can share with the audience now that they can do to try and help self-care until they can get to someone like you, or possibly get to someone that can help with stretches?
Well, when it comes down specifically for pain, you have two categories. You have chronic pain and acute pain. So acute pain is short onset, and no, acute, yes, a short onset. So when you have that, based on that injury, you want to apply ice for that area until you're able to see someone within that week or within the following weeks. But when it's chronic, it's gone 6 weeks or more, then in that instance, you want to utilize cold, hot, cold, hot. You want to always end on cold. And hopefully before 6 weeks, you really want to try to get to some massage practitioner so that they can help with that. But we also like to encourage you to go and see your primary care physician so we can work along with them. Because sometimes we need to know x-rays, we need to know what is going on inside the body so that we can taper and make sure your massage is specific, because we don't want to cause further injury. So that is why it is important to see your primary care physician immediately, and once they give us a diagnosis or a plan of action, then we can work along with the physician in getting you whole.
Yeah. Good information. There was one point for me within this year while we were trying to understand what was going on with my stomach that I asked some questions, and Stacey said, I'm not your primary doctor, so you might, want to schedule an appointment. I did, what she suggested, and we found out that my cholesterol was high. Part of that was my fault because I just don't really care to have a whole bunch of pills in my system or my liver. And do you remember the number? Was it 146, 200? What was the number?
I can't remember. It would be good if we had that in front of us.
Yeah.
But however, I do know that with cholesterol, concerning the LDL, you definitely want it below 200. But we really aim to get it below 150.
Yeah, I can't recall the number either, but I can tell you that it was high. It had to have been like 144, 164 or something. And I would not have normally went to the doctor to see this. This is not something that I think about on the norm. I know when Eric and I, before we got married, we did a blood test. I know that's not required in a lot of states anymore, but we wanted to. And we found, that he had high cholesterol. So we were fortunate to find that out and got him on medicine. So I'm grateful that, whatever was going on with me at that time, again, it was still something dealing with my stomach. When I made the appointment, they were like, yeah, this is how I started back taking my medicine immediately. I also started doing CMOS. That's a whole nother topic in conjunction with my cholesterol medicine. But if I recall correctly, I got it down to 99 or 100 within 2 months.
It was rapid because
Yes.
2 months to get it in normal range and in a low normal range.
Correct.
That it was good to see.
Yeah, thank you.
Yeah.
But again, I would not have considered that it's my stomach. It's not because, I'm sweating, having heart palpitations or anything. I was just trying to figure out what's going on with my stomach or what have you. So cool. My last question that I have here is, what would you like to see more of in the collaboration between medical professionals and massage therapists, unless it's something you've already shared with us?
I would like for physicians to consider massage therapists to aid in pathology specific care. So if someone comes in and just say they're seeing a cardiologist, then I would love to see that cardiologist say, it would be good if you got a massage to help with circulation, to help with left ventricle ejection fracture, something major that you probably won't hear, but that helps with how much your heart is able to pump out.
Okay.
And so when you start having different specialties include massage, you start seeing it's more than medical. It's a whole wellness approach.
Right.
And so, give you an example, if someone has diabetes, well, I know in my personal experiences with clients who have diabetes, we check the glucose levels prior to the massage and post massage, and I find within the first hour I'm able to drop that those numbers down at least by 20 points.
Oh wow, that's huge. Double digits?
Yes, 20 points. So I've seen it consistently across the board with various clients. And so if you have an endocrinologist who could say, okay, ma'am, sir, with this, I would like for you to see this massage therapist to help regulate your insulin resistance. Then I find that they'll start trusting that us as a massage therapist and as a actual science, a profession that really can help with wellness overall.
Wow, that's interesting. I remember post-pandemic maybe, I was telling you I had sciatic issues, and then my primary, she actually had a young lady there. I cannot tell you her proper name, but she used to do tapping. That's what she called it for me. And I recall one time I cried. It was not uncontrollable, but it was spontaneous. And I do know that I had a car accident in my 20s, lower lumbar issues, which is what prompted me to start wanting to get those massages from you in the beginning. And I do, see a chiropractor, but she would do these tapping type of techniques on my back because the pain would shoot down my leg, and it was radiating mostly on that right side. So my primary doctor supports this type of science. The young lady's not in her office anymore just because a lot has happened with that office and the pandemic or what have you. But I'll be interested to see how healthcare in the United States specifically will look better for people if and when we started subscribing to or suggesting, hey, you should actually go get a massage. I wonder how much healthier we would be as a country. Or you spoke about it earlier, anxiety. I asked the question about stress, what that would do to our society. That's really something to think about.
Right.
It's really something, because you said the science would support it.
It does. And with the fact that we have, the board, we have such a wealth of nurses who are massage therapists, doctors who've had that background, chiropractors who also have that background. And when they collaborate together and have these wonderful journals, medical journals, and they can prove from A to Z why this method works.
Right.
The proof is in the pudding that massage should indeed be a part of modern medicine.
Well, I can tell you it's a part of the modern everyday life of Aquinas. So even if Stacey's not here physically rubbing me, touching me, or using, some of the equipment, you may be able to see in the back, there is a TheraFly, because I will be getting a massage after this. She has taught me some things that I can do, like castor oil is something, that you've suggested. It's a natural way to help clean the body or, continue to purify. Organic orange, cranberry juice is another one. Sometimes people have urinary tract infections for whatever reason. You can't go to the bathroom, it's hard or burning. That's one way. But I also learned from you that it's a blood thinner. Cleanser. Wait, what's it?
It's a blood purifier.
Purifier, that's the language. Yes.
Organic.
Organic, because it's tart. Let me just tell you, Ocean Spray, woo, that is sweet. But the organic cranberry juice is tart. But again, you build up a tolerance, so you don't have to take a shot glass of it or what have you. So those are some of this is one aspect of my life that you all are definitely being drawn into. I wanted to make sure I shared it with you all because again, I've been gone for a long time. But Stacey, please tell people how they can get in touch with you. Give us all the handles so that the people below or above, if you will, comments below is what I'm referring to, can take your information.
On Instagram, I'm Labetta_Hudson, and on Facebook, I am Stacey Hudson, easy to find. And more than anything, if you want to contact me via this podcast, I'm sure Aquinas would definitely help me with that. So I'm very old school. I'm more word of mouth. Because that is how I met Aquinas.
That's 100% true.
Word of mouth. Since I started since 2001, I was in practice before there was a Facebook. I was in practice before there was an Instagram. So definitely that is how most people have known me, through word of mouth, with health fairs and what have you. So make it happen.
I will. I'll make sure I put our handle information down at the bottom, everybody. I want to say thank you for tuning in. I can't wait to do more of this with you all. Stacey will definitely be back because there are other things, that Stacey and I talk about. Husbands. I don't have kids, but we do, like to travel. And we are, a bit old school. But for the most part, during this year away, Stacey has definitely helped me understand, there are other aspects, as we get older, our body does not process or handle stress. Or even wearing heels, like we used to. So it's just been very eye-opening for me to not only have that information, but have someone so close, and she's truly down to earth. This is not a plug. I don't get a free massage for, saying this to you all, but I just want to make sure you all are aware and have access to this knowledge. Again, I'll make sure I include her handles down below. Again, thank you for coming to What Comes Up Comes Out. I'm going to do a better job of trying to make sure I stay consistent for everybody. My face will not always look like this. I want to always have this beat, so screenshot it, take a picture. I probably will just be regular next Sunday, but that's my goal, team, to come back and give something special, significant, real that's happening in my life every Sunday. So I hope you all like the background. I hope you can appreciate this authenticity, if you will. And until next time, everybody have a great one, okay? Thanks again, Stacey, for stopping by.
Thank you.
You're welcome. Bye, y'all.
Bye.